Hi, this is Renu Wang from MHC. Today we're at Grand Coptham Waterfront for the second annual Healthcare and Insurance Collaboration Forum 2011. Dr. Low Lee Yong is invited to be one of the panelists to speak about balancing necessity of treatments with cost. Let's take a look.
For peer review, actually, if you're talking about GP, there's very little you can do, okay? But for the insurance companies, what we have done that has become a model that you can probably refer to is we have actually captured millions of database, so-called visits, and we are profiling, the thousands of GPs that are in our panel. What we do is we know the norm, the mode, the medians of every diagnosis for every GP. So what we are doing now is we're advising the insurance company and say, look, this GP's average fee is, $30 compared to that guy is $150 for average cough and cold. And the treatment for cholesterol, this GP on the norm is about $80, but that GP is $200. So what we are hoping the insurance company will do, will look at this data objectively, and then some of these GP we can bring them to task, ask them why is it that you're more expensive. If necessary, sometimes we scrutinize even the drugs patterns and so on. And we do pick up cases of abuse, and cases that can be counseled, we actually go in and counsel them and say, look, why are you using all the latest branded drugs and pumping them onto the patients? And of course, they give you all kinds of reasons. But when you analyze the whole database across the board, because the GP doesn't just see one company's employees, they see across the board different kind of cases. So we realize that sometimes the GP, the doctors themselves, they just have this habit of using the most expensive drugs. So when we pick up these kind of cases, these are the cases where you can do something about it. And it's only when you analyze data, do data mining, especially if you involve volumes. And if you have a huge amount of data don't lie. That's where you can pick up this kind of abnormal behavior. And that's where we use the technology to really do something about over-treatment. I call it over-treatment because if there's a cost-effective generic, why do you have to give the most expensive branded drugs that